Hello, and thank you for clicking the link. It's Dr. Pavlo here from Atlanta Salute Spa. Our company specializes in helping people do alternative therapies safely and correctly, something that's very, very important. This particular short video is to talk about Cesium therapy. Its real name is high pH therapy, HIGH, high pH therapy. Now, a lot of people just refer it to cesium therapy, but it's actually a combination of 15 different minerals. And when used correctly, is a very safe therapy to do. It's very, very good at getting shrinkage with almost all cancers. Some cancers, it completely gets rid of them. It's really good for bone cancer. We actually have two therapies now that we use for bone cancer. We only use this as a last resort. It has some side effects of a little bit of nausea when you first do it, which is something we prefer to avoid if we can. So the good news is we have other therapies for bone cancer. We use this one for people who have got advanced cancers. It's our fifth therapy, and so we only use it. We add our therapies in order, and if any of the therapies are working, we don't move to the next step until they're not working anymore. Some things will slow cancers down. Some will get rid of certain cancers, but others will be stubborn and stay. So we then add the next therapy and so on if you've got time. Otherwise, we add them every month or every week, depending on how advanced you are. So every single person's an individual person. So the question is, does high pH therapy or cesium therapy work? Certainly, when done correctly, without a doubt. I do it intravenously, and I've never had an incident at all in 15 years of applying this therapy, and about 7.5, 8 years of doing it intravenously. I've never had anybody hurt, harmed, or any incidents in doing that. There are many cases where that is not the case. So where I'm different, I don't do it as aggressively as some people try to claim that you can get rid of cancer in 14 days. It's just not true. Do some cancers disappear that quickly? Sure. I've seen a fist-sized tumor in a mouth disappear in 7 days doing it intravenously. So no doubt, yes, it does. The faster growing cancers do disappear quicker. Is all the cancer gone that quickly? I don't know. So I choose to do what I found to be the most successful way of applying it, and that's 3 months intravenously. Can you do this at home orally on the home program? Yes. You need to follow instructions very carefully. You need a supporting doctor, and that doctor needs to do your blood tests weekly and keep an eye on you. He's responsible for your care because he's there and he can check your blood pressure and so on. We get you to do a few things. Get a blood pulse meter so you can, or an iPhone watch, which can keep an eye on your pulse. And if it's too high or too low, you can just take it easy at that particular time. 95% of people have no issues whatsoever, and occasionally somebody might get slight heart palpitations if we're treating it more aggressively. Now, we only do that if some person's got, the odds are they're going to die if this doesn't work, so they don't have a choice but to do it, hit it a little bit harder than normal. Again, never ever experienced a death or bad incident where high pH therapy is needed somebody to be hospitalized or an ambulance called. When it's done correctly, it is 99.9% safe, the same as if you have surgery or have any other treatment. They're all 99.9% safe unless you have an allergic reaction or an unforeseen incident that is not common at all. So how is this applied at home? It's done with a combination of 15 minerals, but more importantly, there's about a month preparation before you do it. That's why we don't have anybody become ill. We prepare you for a month beforehand on a very specific nutritional program to prepare your body, and that's why I think we don't have any incidents. It's because the people are prepared. It's just not rush in, do this, and so on. then we give very clear instructions, and if they're followed correctly. Now, 15 years, for the first time ever, recently I had somebody who had piles, and they're the first person who couldn't do this therapy. I have never had anybody not be able to do this therapy, but this person started, and the passing of the salt when they went to the toilet burned so much that they managed to do it for a few weeks, but they couldn't do it long enough to get a solid result. The cancer shrunk in the time that they done it, enough for them to eat comfortably, because they couldn't enjoy their food, because the cancer, almost the size of a football, was squashing their stomach. It relieved that enough for them to eat and not have discomfort. So that was good news for them, and they've gone off to do other things now. If they could get here and we could do it intravenously and get rid of the cancer more quickly, that would certainly work in their case. But everyone's an individual. So I'm just here to say that we're having a webinar, and we're going to feature the high pH therapy, the details of how it's done. It's not going to have the it's going to have the pitfalls and explain to you what not to do, which is really important. If you're not working with a practitioner, you shouldn't do this therapy. So we're going to explain that and why that is the case. You need to find somebody that will hold your hand, be on the phone 24 hours a day, and help you do the therapy correctly and safely. What to do, when to do, how to do it, and why to do it, and so on. So this webinar is going to be about 1 hour plus questions and answers. So it may go for an hour and a half. We hope to have one every month, time permitting. So you're invited to that. Invite your family and friends. The more people who join in the webinar, the better. The more questions that are asked. You ask a question about whatever, and you've actually done somebody a favor, because you've asked me something that they didn't even think of asking yet. They probably would have after the webinar. So the more people that ask questions, the better for everybody. And so you will be able to interact with us on the webinar. You won't be videoed. I'm the only one on the video. Your questions will be typed in the bottom of the webinar, and I'll answer them as they come up. I will have an assistant. We may even have some guest speakers from one month to the other. And so simply below here, you click where's my hand? There we go. Click the like button. On the other side, the subscribe button. The subscribe simply allows you to be on our list. You'll see thousands of people are on the list already. If you subscribe, you simply get a notification when I upload a video. And you say, oh yeah, I'm interested in that, or I'm not interested in that. That's a choice you make. But at the very bottom, you'll see across the bottom there some wording and a link at the end of it. That colored link is what you click on, and you put in your name, your country, and your phone number, and we won't be calling you, but the phone number is to let you know. In some cases, we send a text just before the workshop starts. And your email address. We don't spam you, and we don't send any junk. We don't have the time for that. We're simply going to let you know when the workshop is on, and if you want to come, you attend it. As simple as that. You register for the webinar, and that'll give you a day's notice, and a few hours notice, and 5-minute notice, and when it's starting. People have asked us to do that because you subscribe to a webinar 2, 3, 4 weeks before it actually occurs, and you're going to miss it if you're not notified. So people have said, listen, when we register for the webinar, give us plenty of notification, because it's easy to forget. Even the day before, it's on tomorrow, but something happens and you forget. So those emails will happen if you register for that particular webinar. It doesn't register you for everyone, just that one. And so please click the link, subscribe, share this video with your friends, your cancer support groups, and as many people as you can. The more people that attend, the more questions that get asked, the more you're going to learn. And that's what it's all about. Me teaching you, sharing with you 15 years of experience, the pitfalls to avoid, what to do, how to do it, why to do it, and how to do it correctly. The most important thing. High pH therapy is a good therapy when done correctly with the right person holding your hand. If you don't have an experienced practitioner helping you, He doesn't teach you the pitfalls and the special tricks. You know, can you do this rectally, or can you do it topically? How to do it topically? Why to do it topically in some cases and not in others? How, if you do it incorrectly, you can actually cause the cancer to grow. So, is this a good therapy? Yes. It's one of the reasons I'm still in the industry, because it's helped me get rid of some cancers that were so stubborn that other therapies were not working with them. Does it work in all cases? No. What cancers doesn't it work in? Attend the workshop, I'll tell you. Ask that question. I'm sure you need to know more, but yeah, this is just a quick invite for the webinar. So again, signing off, Atlanta Salute Spa, offering the alternative therapies that others don't, all in one program, giving you a choice that you didn't have before. Knowledge is power when used in a positive way, and we're here to give you that knowledge. Thank you very much, and bye for now. And thank you again for subscribing and liking this video and sharing it on your Facebook and friends. Ask them to also share it to others, because again, knowledge is power when used in a positive way. Bye for now.